Welcome to the Beverly Hills Plastic Surgery Podcast. This is an exciting podcast. Dr. Ravello, are you excited?
I am super excited.
Here with me, as always, Dr. Millicent Ravello, to talk today about our new series, the Plastic Surgery 101 series of podcasts.
Bringing it back to the basics, everything you need to know about what we do in plastic surgery. So we've been doing this podcast for 3 years now.
Yes.
And we have covered an entire breadth of plastic surgery. There are still topics out there that we haven't touched on, but we've covered just about everything. And a lot of what we've covered, we've gone into very specific depths and specifics on specific separate podcasts. And what we want to do is sort of just bring it back to some of the original basic plastic surgery procedures that we do, because we did most of those in the very beginning of this podcast, and so people would have to like scroll through 3 years of podcasts to find those.
That's true.
And so we're kind of going to start over a little bit, but not really. I think as we touched on with the recent podcast, things change so quickly in plastic surgery. So there is a solid chance that the things that we say today about breast augmentation might be a little bit different than the things we said 3 years ago about breast augmentation.
Yeah, I mean, it changes rapidly. That's
Right.
why we go to all these courses and stay updated. And, we were just in Las Vegas at a course, and there were things that are new, and there are new consents we have to use. And there's a patient checklist and a black box warning. And there's all this stuff that keeps coming around, and then some of it goes away. Oh, you don't have to do that anymore. Now you have to do this.
Right.
So yeah, it changes. You cannot sit there and just say to yourself, we are going to, live and die by what we learned as residents. It is so, like, what I learned as a resident in the Stone Age is dramatically different.
Obsolete at this point.
It is. It's obsolete. Yeah. And so now, doing this Plastic Surgery 101 series, we're going to start with breast augmentation today, but we're going to go through everything. We're going to go through facelifts, lipo, like you name it. Right. And we're going to bring home the basics for people. And as always, we always dive deep somewhere along the way.
I know. We get a little off track, and then we have to bring it back in. But we're really going to try to just stick to the basics here with breast augmentation, what you need to know, a primer.
So let's do it.
Yeah. So, first things first, the patient that comes in for a breast augmentation. These are the things that your surgeon is going to ask you because they are pertinent to what you want to achieve. Number one, what size breasts do you currently have? Number two, do you have a history of childbirth, pregnancy, breastfeeding? Number three, do you have a history of weight loss? Number four, do you have any other medical problems? Number five, what is your desired goal? What are you looking to achieve?
Yeah, and I think one of the things, too, for our listeners to kind of understand in that medical history is there a family history of breast cancer?
That's huge. Family history of breast cancer. When was your most recent mammogram? If you were of mammogram age, have you ever had an abnormal mammogram? Everyone has a little bit of a different recommendation. I think there's different societies that recommend mammograms at different ages, but I think in general 40-ish is when most women with average risk factors will start getting mammograms. I start having any of my patients over age 35 who are going to have breast surgery get a mammogram. And that's only because I'm so much in the breast reconstruction space, and I'm seeing breast cancers being diagnosed earlier and earlier in patients. And what I don't want is to go in and do a breast surgery, rearrange the breast, cut through breast tissue, only to find out that that patient had an active cancer, and now I've potentially dispersed the cancer, throughout the breast. So these are the things that we need to make sure we clear before we do any breast surgery. So yes, that is why personal and family history is very important for breast surgery.
So once you have that information kind of pulled together, how big do you want to be? I always say, and by the way, grab some photos of breasts that you like.
Super, super helpful, because if you come in and tell me you want to be a 32D, and then you show me a picture of someone who is like a 32H, I'm like, okay, well, that's helpful to know, because those are two very different things in my mind. So photos just sort of make everything an even playing field. I know what you're referencing. You know what you're referencing when we throw around these very arbitrary bra sizes.
Yeah, because, bra sizes are